The spate of stroke the world over is increasing at an alarming rate, most especially in African countries like Nigeria. In order to intervene in the growing rise in stroke cases, Rise Clinic, in collaboration with Neurosurgery Specialist Hospital, National Hospital Abuja, and North Bay Medical Center, US, recently organized a 2-day training workshop on stroke management tagged Stroke Budding in Society and the Way Forward. The workshop, which witnessed a large turnout of caregivers and other stakeholders, was also based on the high prevalence of stroke among males and females in Nigeria, nay Anambra State.
Education and healthcare is required for any economy to grow, but unfortunately, it is not yet priority here in Nigeria. That is why we have our teachers and our healthcare professionals underappreciated. But guess what? We want to tell you that as long as you're open-minded, you're willing to be transparent in the collaboration which we'll ask you for, we'll hope to see a new dawn in healthcare practice in Anambra State.
Stroke is has to do with a brain dysfunction. But that brain dysfunction is due to an interruption in the blood supply to the brain. Now, usually the consequences or the aftermath of the stroke would have to last for more than 24 hours for you to effectively say that this is a stroke. Otherwise, if whatever it is that has happened resolves within 24 hours, it's not stroke, it's now what we call a transient ischemic attack. But basically, it's a brain dysfunction due to a problem with the blood supply. It's of vascular origin and it must last for 24 hours. The disability emanating from it must last for more than 24 hours for it to be termed a stroke.
For it to say that stroke has occurred to anybody, it means that the person must have suddenly lost a neurological function. Okay, so either that neurological function is localized to one part of the body, or is involving virtually all the parts of the body, and it must be sudden. And then when you trace the origin, you find out that it's of a vascular origin. And again, too, it will have lasted more than 24 hours, or sometimes leading to death. That's when you say that stroke has occurred. So, like if somebody who suddenly develops weakness of one part of the body, maybe the hands and the legs, or the mouth starts moving to one side, or the person develops difficulty with speech, okay, and sometimes it can even lead to loss of consciousness. When this kind of thing happens suddenly, you are bound to say most likely that stroke has occurred.
We can begin to map something like that related to stroke, related to a narrow and defined disease. Is there a way that that can spread and scale to have an even bigger impact on trauma and other emergencies that are so important to this region? So with that, I'm hoping that my conversation just gives us the knowledge that we can do so much of this right now.
In order to ensure the participation of relevant stakeholders in the workshop, a house-to-house sensitization and fact-finding visits to the homes of some stroke survivors were carried out by the organizers of the event. This was capped off by a visit by a team from Anambra State government, led by the Special Advisor to the Governor on Medical Facilities and Supplies, Dr. Vincent Opala, to Rise Clinic Adaziani, to indicate government support to the program.
There's no easy way to go through it. There's no shortcuts to be taken here. But I just think that it's important that you continue to do what the doctors told you and continue to work towards the physical therapy.
Stay positive, stay optimistic. Like Peter said, it takes years. And also one thing that I do recommend is just challenge yourself. If you want to walk around, every day for, 20 minutes, try increasing it by 1 minute every week. See if you can do it. If you can do it, then keep increasing. If you can't, then try to improve there. Just try to challenge yourself, because the muscles that you haven't been moving on your legs or arms, they haven't moved as much because you've had a hard time moving it around. So just try to challenge yourself, try to push yourself to get better, and I'm sure you will.